Hello, my name is Aiko Sode, and today I'll be talking about Americans' fight for universal health care. Introduction. For my topic, I want to address the lack of universal health care in the United States of America. This is an issue that everyone can rally around since everyone has had to go to the doctor at some point in their lives. A lot of other first world countries like Great Britain, France, Germany, Canada, and Australia provide universal health care to their citizens. Surprisingly, some other countries that are a lot poorer than superpowers like the US have universal health care as well, such as Brazil. These facts raise the question as to why the United States doesn't have universal health care. Normal citizens pay taxes and slave away at their jobs and still have to struggle for health care. Where's our tax money going? Why isn't the billions of dollars in tax money that citizens are paying helping us out more? After all, isn't the government's job to serve its citizens? These are all questions I've asked myself many times. As a kid, I remember a time when I had to go to the ER for an asthma attack. A few days after receiving treatment, my parents agreed with a huge bill that cost thousands of dollars. I remember being amazed at how much I had cost my parents to simply make sure I got the care I needed and think to myself, how is it possible that something as simple as an asthma attack could cost my parents that much money? Facts. Healthcare is one of the most significant socio-political topics in the US, and citizens currently rank healthcare as the most important issue when it comes to voting. The US has historically utilized a mixed public/private approach to healthcare. In this approach, citizens or businesses can obtain health insurance from private insurance companies such as Blue Cross Blue Shield, while individuals may also qualify for public government subsidized health insurance such as Medicaid or Medicare. In contrast, the vast majority of post industrial westernized nations have used various approaches to provide entirely or largely governmentally subsidized universal health care to all citizens, regardless of socioeconomic status or SES. Differing versions of universal health care are possible. The UK's National Health Services can be considered a fairly traditional version of universal health care with few options for and minimal use of privatized care. On the other hand, European countries like Switzerland, the Netherlands, and Germany have utilized a blended system with substantial government and market based components. Keeping universal coverage basic will keep the cost of the taxpayer down as well. It's true that as a share of its economy, the United States spends about twice as much on healthcare as other high income countries. But in most other wealthy countries, this care is primarily financed by taxes, whereas only about half of US healthcare spending is financed by taxes. For those of you following the math, half of twice as much is, or the same amount of taxpayer financed spending on healthcare as a share of the economy. In other words, US taxes are already paying for the cost of universal basic coverage. Americans are just not getting it. Arguments against. Though the majority of post industrial westernized nations employ a universal healthcare model, few, if any, of these nations are as geographically large, populous, or ethnically/racially diverse as the US. Moreover, heterogeneous climates and population densities confer different health needs and challenges across the US. Thus, critics of universal healthcare in the US argue that implementation would not be as feasible, organizationally or financially, as other developed nations. There is indeed agreement that realization of universal healthcare in the US would necessitate significant upfront costs. Arguments for universal healthcare in the US offers several noteworthy advantages compared to exclusive systems with inequitable access to quality care, including addressing the growing chronic disease crisis, mitigating the economic costs associated with said crisis, reducing the vast health disparities that exist between differing SES segments of the population, and increasing opportunities for preventive health initiatives. Perhaps the most striking advantage of a universal healthcare system in the United States is the potential to address the epidemic level of non-communicable chronic diseases such as cardiovascular diseases, type 2 diabetes, and obesity, all of which strain the national economy. The economic strain associated with an unhealthy population is particularly evident among low socioeconomic status individuals. Having a low socioeconomic status is associated with many unfavorable health determinants, including decreased access to and quality of health insurance, which impact health outcomes and life expectancies. For example, diabetics with low socioeconomic status have a greater mortality risk than diabetics with higher socioeconomic status. And the uninsured diabetic population is responsible for 55% more emergency room visits each year than their insured diabetic counterparts. The incidence of obesity is almost much greater among low socioeconomic status populations. The cost of obesity in the US, when limited to lost productivity alone, have been projected to equate to $66 billion US dollars annually. Accessible, affordable healthcare may enable earlier intervention to prevent or limit risks associated with non-communicable chronic diseases, improve the overall public health of the U.S., and decrease the economic strain associated with an unhealthy, low socioeconomic status. This graph right here shows how low socioeconomic status can lead to other things. It shows its relation with factors such as hypertension, diabetes, smoking, obesity, etc. The issue with our money. Although we just experienced a pandemic in which over 1 million Americans died, healthcare reform doesn't seem to be a top political issue in the United States right now, and that's a mistake. The American healthcare system is broken. As you know, we're one of the few developed countries that does not have a universal coverage. We spend an extraordinary amount on healthcare, far more than anyone else, and our broad outcomes are middling at best. We currently spend about 18% of GDP on healthcare. That's almost 12,000 per American. It's about twice what other countries currently spend. With that much money, other post-industrial countries such as Singapore and Canada could likely solve the issues it faces. By spending substantially more on healthcare, substantially more on healthcare is something they feel they cannot do. We obviously do not have that issue, but it's intolerable that we get so low for what we spend. We cannot seem to do what other countries think is easy, while we've happily decided to do what other countries think is impossible. But this also is what gives me hope. We've already decided to spend the money, we just need to spend it better. This right here, this graph here shows our healthcare spending compared to other countries that are developed as well. Universal healthcare for New Mexicans. While it is true that it'd be impossible for me, once insignificant UNM student, to solve universal healthcare for all of the U.S., I can still try to at least start the fight for universal healthcare with New Mexico. In order for New Mexicans to be granted universal healthcare, the legislature should pass the Health Security Planning and Design legislation to establish an approximately 4-year, publicly accountable, transparent process to design that plan. Health security is backed by a huge coalition of groups, including the Hispanic Farmers and Ranchers, Las Cruces, Anthony, and Doña Ana County. New Mexico's health security plan would ensure almost all residents. The Health Security Planning and Design legislation continues a carefully considered approach. It creates the Health Security Planning and Design Board to the detailed design of the plan and pass it on to the Commission. The Commission will complete the final design elements, have a cost analysis conducted, and develop a funding system before obtaining final legislative and executive approval to begin enrollment. The plan could begin operations in 2025. People with opposing views may say that it is impossible for the United States government to provide universal health care to its citizens because of the huge cost and multitude of different communities within the U.S. While it is true that other countries with universal health care are not as diverse as the United States, and the upfront cost of national guaranteed health insurance for U.S. citizens would be enormous, the price that those without health care pay is still greater. No one should have to endure the emotional and physical suffering that comes with a huge bill when they just wanted to get the care that they needed. After watching this video, you may be asking, what can I do to motivate the United States government to provide its citizens with universal health care? My answer to you is to protest, kick, and scream if you have to. At the top of your lungs, the universal health care is important to the public, and spread the word to your family and friends. Find people who have had bad experiences with healthcare and tell them to present their stories to their peers. As Janetta Sagan once said, silence in the face of injustice is complicity with the oppressor. Only by being loud and obnoxious can we, the citizens of the United States, push the government to be more efficient with our tax money. Whether you choose to stay with me or not, know that I will never rest until healthcare is taken care of for all.